Very interesting article from the US about the prognostic implication of the BCG failure patients. In this article, they studied those patients and compared them to patients who had recurrence after the induction course only. Obviously, BCG failure means induction course plus at least one maintenance dose. So they compared those patients together, and they confirmed that people who have BCG unresponsiveness are more likely to require salvage radical cystectomy, and people who opted for second-line bladder sparing therapies are less likely to remain free of tumor recurrence. So BCG unresponsive disease independently predicts inferior high-grade recurrence-free survival and cystectomy.